Hello, and welcome to your guide to the Affordable Care Act. My name is Trina Noel. I am a healthcare specialist with Alkali Benefits and Insurance Services, and I will be discussing the Affordable Care Act with you today. You may also hear terms healthcare reform, which is referring to the same thing. Now, healthcare as we know it is being overhauled. A change in healthcare of this magnitude hasn't been seen in this country since Medicare and Medicaid became law. There are many videos available regarding healthcare reform on the Alkali website. Please visit us at www.alkaliinsurance.com to learn more. Today, I will discuss some of the key changes to healthcare and your responsibilities as a U.S. citizen. So much has changed over the last 3 years. Many do not know where to start to find out if they need to purchase insurance in 2014. So I will discuss the exemption and non-exemption options. Also, if you are required to purchase health insurance, you may qualify for a subsidy. I will discuss those qualifications with you as well. So let's get started. March 23, 2010, President Barack Obama signed the Affordable Care Act into law. Through much scrutiny, it was upheld by the Supreme Court June 28, 2012. As of today, it doesn't look like it will be repealed. So it looks like the Affordable Care Act is here to stay. The following implementations are available for policyholders with plans starting after March 23, 2010. If your plan started before March 23, 2010, it is considered to be grandfathered, and these benefits may not apply to you. And on September 23, 2010, the lifetime dollar limits on essential benefits were removed from plans. Dependents up to age 26 are now allowed to remain on their parents' plans if they're not married, except in grandfather plans. Also, at that time, dependents under the age of 19 became guaranteed issue, so they were no longer required to go through medical underwriting. Preventive care is now covered by your insurance plan 100% without cost sharing if your plan is not grandfathered. And insurance carriers are no longer prohibited from terminating or dropping a policyholder due to sickness. August 21, 2012, the Women's Preventive Services were added to non-grandfathered plans, which includes many tests and screenings available for pregnant women. The next phase of the healthcare reform, and a very important phase of healthcare reform, begins January 1st, 2014. At that time, insurance carriers will no longer be able to deny coverage due to a pre-existing condition. If you are required to purchase, will be incurred if you do not find acceptable coverage. Open enrollment for the Federal Exchange begins October 1st, 2013. Now, the individual mandate is your responsibility as a policyholder starting January 1st, 2014 and beyond. At that time, your health insurance plan has to provide the following benefits in order to be considered credible coverage. If your plan does not provide these minimum essential benefits, you will incur a penalty, and the penalties are listed below. So much information has been released since healthcare reform was signed into law. Many do not know where to start to find out if they are required to purchase health insurance in 2014. If any of the following apply to you, you are not required to purchase health insurance in 2014. So there is no penalty for you if you go without insurance. If these do not apply to you, let's continue to the next page. There are more exemptions available. Now, health insurance through the following sources will satisfy the requirements of the Affordable Care Act. So if you have insurance through Medicare, Medicaid, TRICARE, Veterans Health Insurance Program, if you have a plan offered by your employer, or if you decide to purchase on your own through the Federal Exchange, or have a grandfather plan, you have satisfied the requirements for health insurance, and no penalties will be assessed. If neither of these apply to you, you have to purchase a health insurance plan, or there will be a penalty for going without insurance. If you are required to purchase a health insurance plan, the government may provide a subsidy or a tax credit to you to help pay for the premiums and make them more affordable. So here are your options for premiums. If employer coverage is available, you are not eligible for premium subsidy unless your employer plan costs more than 9.5% of your annual household. Also, if you will qualify for a subsidy if your annual household income falls between 133% through 400% of the federal poverty level. For now, the rates for the health insurance plans have not been released. You can estimate your subsidy, but these are estimates and they are subject to change. The premium subsidies are based on your annual household income and the premium of the Silver plan. And you can visit the website listed here to find out the estimated amount of the subsidy you qualify for. In summary, the Affordable Care Act is a federal law. It was upheld by the Supreme Court, and as of now, it looks like it is here to stay. If you qualify for an exemption, you are not required to purchase a health insurance plan. But the next phase of implementation is January 1st, 2014. If you do not qualify for an exemption, you are required to purchase an insurance and will incur a penalty if that plan is not purchased. Subsidies are available for those that qualify to help pay for the premiums of the health insurance plans. If you would like to learn more information regarding healthcare reform, you can visit our website at www.alkaliinsurance.com to see more videos and also more information. If you would like to speak with me directly, I'll be more than happy to answer your questions. Please give me a call at area code 972-673-0045, extension 104. You can also send me an email if that is the best form of communication for you. I would like to thank you for your time, and I look forward to speaking with